really concerned about the public health impact of communities all across this country. I want to focus on one of the basic medical services that children get at these visits, which are immunizations. Vaccine hesitancy and misinformation are at dangerous levels in America. Policies that risk lowering vaccination rates risk the health of children, of seniors, of pregnant women, cancer patients, and other vulnerable populations. But this administration's actions risk actively undermining public health and efforts to ensure that children get the vaccinations that they need. Dr. Falusi, what are the specific public health consequences if children and immigrant families delay or do not receive immunizations?
Right, it just is with any child, going without vaccines leaves them susceptible to illnesses such as the flu. We're entering flu season now. Very much concerned, right, about kids who may be unvaccinated against the flu coming in with coughs and colds and fevers that may last a week or two, or ending up in our hospitals or in our ICUs. I also recognize that I have trainees who've never even seen some of these illnesses that we've been vaccinating against for 10 or 20 years, and worrying now that we may have more children who are unvaccinated and coming in with these illnesses that we have stopped sort of thinking about because we've been fortunate enough to have significantly reduced the frequency of these illnesses. And we also know that children then go to school, and I worry about children who are unvaccinated being around other children, as we all know children share germs very readily, and being that it's, again, winter time, germs can spread easily indoors. So I think it's incumbent upon us to ensure that children have full access to the health care that they're eligible for and that they deserve, including these public health measures such as vaccines.
And obviously, vaccinations are critical to reducing preventable death, right? And so if we have a whole cohort of children around the country who are not getting these critical vaccinations, which could save their lives, we have a real problem on our hands. As you know, as you noted in your testimony, 1 in 4 children in America lives in an immigrant family. These consequences will be felt in all of our communities.